forgiveness as I have note cards. Anybody that knows me knows I'm a little bit long-winded, so I'm trying to keep this down to 3 minutes, and we're going to see how this works out. So the problem that we were addressing at the White House was one related to the current research system being a barrier to providing the best care for people who live with life-shortening diseases. Research efforts are nearly exclusively investigator-driven, and there's an urgent need to increase the throughput of novel ideas leading to user-centered innovative therapies. So working with Daniel Grossamy, a research associate professor at Cincinnati Children's Hospital, and Ronnie Zeiger of Smart Patients, we set out to compare the effectiveness of online patient and caregiver engagement platforms and traditional Delphi methods to prioritize a research agenda for psychosocial and spiritual research. And this is how we did it. So there were two approaches that we tried. The first was the Delphi Method, which is a means to develop consensus on a specific topic by utilizing a group of experts, so patients in this case, through, though the process is limited by turnaround time between up to 3 iterations and also by attrition. And then we compared that to online patient engagement platforms, again, in this case, Smart Patients, which included a questionnaire-type posting as well as structured conversation around a given topic. So they were both given the same type of information to respond to. And the long-term goal was really to accelerate the pace in research in areas that are most likely to improve the lives of people who live with cystic fibrosis. And then to create a community-based participatory research as a step toward turning participants into collaborators. What we learned was that the online engagement platform provided more rapid data collection with lower attrition. We had 20 participants on the Smart Patients platform over 10 days, and we had 21 participants in the Delphi Method over 14 weeks. Platforms like Smart Patients can provide peer-to-peer support in all areas of health and care while improving the efficacy and the speed of research, reducing the time it takes to bring these valuable tools to patients and clinicians. And also, it's very important to note here that these two research methodologies provided dramatically different results with almost no overlap between the two of them. So the ask that I have for you is to be open-minded about results that are achieved via different research methodologies. Consider trying alternative methods and utilize the expertise of patients and families to create and prioritize research and then translate it into practice more quickly. Often these social learning platforms that are almost exclusively patients and caregivers, they don't feel the social pressure to respond in a certain way when they're just among their peers. I think about that when it comes to publications and peer review. Patients are doing peer review and can do peer review in research prioritization. And then my last ask of you is to share what you learn. My research certainly isn't at all conclusive to say that one research method is better than another, but it does highlight the important differences in the data collection methodologies, and there's still a lot that we can learn. So if we can do this, if we can learn together and try this in different disease communities and show that there is an opportunity to learn in different ways, I think in the future, if we come back in a year, I think that there will be more listening, less asking. We will have trusted social learning platforms where patients are generating the research questions, and then research will be prioritized based on the contribution of those patients from those patients of data that is meaningful to them. And then there will also be a reduction in the amount of time that it takes to move research into clinical practice. So I showed an example of how a more novel research method that took 10% of the time of a traditional Delphi method, and I'm certain that there are further efficiencies that can be found. I also think I'm hopeful that with your help, there will be a growing body of evidence to support this research prioritization through smart social online learning platforms. So thank you. Hey.